In this video, I'm going to show you a slight modification to my favorite exercise for treating low back pain and sciatica, and it might be just the thing you need to finally fully eliminate that stubborn low back pain and sciatica. I'm Schroetke, Doctor of Physical Therapy at Physical Therapy and Hand Clinic of Hillsboro. In this video, I'm going to show you an exercise called extension and lying with hips off center. So as the name implies, it's a modification of extension and lying, which is hands down my favorite exercise and which works for about 70% of people I prescribe it to. However, it doesn't work for everyone. So what you might have found when you did extension and lying, and give it a real go, don't just try 3 reps, try a couple sets of 10 or so, or maybe try it for a couple of days, you might have found that it does nothing, then it makes you worse. So if you had increases the level of back pain or increases your sciatica symptoms, that's pain running down the leg, or you might find that you do it and it actually does help, but as soon as you get up and start walking again, bang, pain's right back down the leg, or the back pain just returns with full force. All right, so for this one, we're on our stomachs, either on the floor, on our bed if it's firm enough, or on some kind of a mat table. And what we've got to do is, if I have pain on the right side of my back, or it's going down my leg, you could possibly have symptoms on both sides, but it'd be stronger on one side. And what we're going to do is isolate that side a little more. We're going to put a stress on it so it's mobilizing and stimulating those tissues more on the side of your pain. So what we do, we get on your elbows to start. My pain's on the right. I'm going to take my hips and shift them over away from my pain. So I go up and over. And now I'll show another angle. So my pain is on the right hand side, or it's going down the leg maybe, and we're going to move our hips away from the pain. So we're propped up on our elbows. Lift the hips up and go as far as you can. It's super important. You've got to get as far as you can. Maintaining this position, hands go right beneath the shoulders, and we're pressing up, maintaining that wedge position. You can do 10 repetitions, 10 to 15 repetitions, trying to get to end range, locking the elbows if we can, and on the last 3 reps, we're exhaling to really emphasize that end range. Now, I can feel myself doing it. I'm kind of losing that wedge position. So to deal with that issue, once again, on the elbows, hips away from the pain as far as you can. Cross one foot over the other, and that's going to kind of lock you in this position. Hands below the shoulders, press up. And I'm hoping you can see this angle I'm putting my back in. It's giving more stimulus on the right-hand side. We're closing the joints down on that side of the body even farther for more stimulation. You're going to do 10 repetitions each time trying to lock the elbows. If it hurts too much, again, it's okay to start at mid-range. And when that gets more comfortable, you try to add more and more range until you get to the point where you're locking your elbows. And we want to get to end range. That's where the magic happens. To do that with this exercise, once we lock the elbows, we exhale. That's called blowing and sagging, because you can see my low back sag. You tend to do that the last 3 reps of your exercise. As you do the repetitions, if you had pain in your leg, it should be hiking up and moving back toward the back. That's a good sign. Or the back pain might decrease. Or the leg pain kind of hikes up and you get a little more back pain here, but that's okay. Keep doing it. If the pain moves out of the leg and into the back, or more strongly into the back, that's a very good sign that this is going to work for you. And then what you'd want to do is get up and walk around and see how you feel. Did it make an improvement? If so, you're going to be doing 10 to 15 repetitions every 2 to 3 hours, or as needed for pain. And you keep doing this until your pain is fully resolved and has been fully resolved for several days. I'm Schroetke, Doctor of Physical Therapy at Physical Therapy and Hand Clinic of Hillsboro. And we've just shown you extension and lying with hips off center. If you like what you've seen, subscribe to our YouTube channel, click on the little bell so that you'll be notified each time we upload a new video. Like the video, share the video with your friends, and leave comments below. Let us know if you've tried this exercise and how it worked for you. We'd love to hear from you.